Dear friends and colleagues, on behalf of Aspire, Ferring and the team in Renji Hospital, Shanghai, I would like to welcome you all to this webinar on a very contemporary hot topic on COVID-19. The webinar will last about 90 minutes. It will begin with a 10-minute introduction on the outstanding and world-famous reproductive medicine team in Renji Hospital, led by Professor Sun. The team is particularly well placed to address the topic, not only because of their outstanding achievement in reproductive medicine, but also because of their very close proximity to Wuhan, the epicenter of the COVID-19 pandemic. First of all, let's look at the first slide. Well, it shows you the three main speakers from the home team: Professor Sun, Dr. Yao, and Xi, and they would talk about COVID-19, what we did in Shanghai, in Renji Hospital, the prevention and control management, and also what do they do in the laboratory, the nursing aspects, and the infection control and prevention. After that, we will have a Q&A time for 25 minutes. It will be a panel discussion, also led by the home team. There will be the extended team members, which I'll introduce in a minute. And then I shall wrap up and close the meeting in about 90 minutes time at Hong Kong time and China time, 4:30 in the afternoon. So can we have the next slide, please? All right, here will be our extended team members who will be involved in the panel discussion. We would have Dr. Hong, Director Physician, Dr. Lu, Resident Doctor, Dr. Nancy Zhang, Physician, Dr. Wang, and Dr. Hu, Embryologist. They'll all be contributing to the discussion and will help to answer questions. So next slide. We should be ready to start the webinar now.
Renji Hospital, as one of the attached hospitals of Medical College of Shanghai Jiao Tong University, was founded in 1844 by British gentleman William Lockhart. Renji Hospital is the second modern Western hospital in China and first in Shanghai, which pioneered the introduction of Western medicine to China. Normally, 15,000 patients pay visits to this modernized third-level Grade A hospital. 272 received surgeries, 378 more discharged from hospital every day.
For the past 176 years, Renji people adhered to the core value of saving the world with heart and kind remedy, and dedicated to how to deliver patient-centered treatment and how to lead and innovate as the pioneer of medical technology.
The nursing of Renji Hospital is started in 1894 and has a history of 126 years. All along, the nurses of Renji Hospital are high-valued patient-centered care and constantly strive for excellence. Our philosophy is to care with benevolent heart, to cure with professional skills, to promote people's health is our goal.
The Center for Reproductive Medicine of Renji Hospital, led by Professor Yun Sun, was established at 2001. It is also established as the following ART-related medical centers: Infertility Diagnosis and Treatment Center of Shanghai Jiao Tong University, 2009. Center for Reproductive Technology and Reproductive Genetics, 2010. Shanghai Key Laboratory for ART and Genetics, 2012. National Research Center for ART and Reproductive Genetics, Shanghai Branch, 2013. Collaborative Innovation Center for ART and Reproductive Genetics, 2014. training base for Shanghai ART 2014. Quality Control Center for ART of Shanghai 2018. In 2019, more than 400,000 person times of patients paid visits to Reproductive Medicine Center of Renji Hospital. The cycle number is almost 10,000, with a leading success rate of roughly 60% in this country. More than 150 pair of foreign couples from around 30 countries were treated here. Embryology Department of Reproductive Medicine Center of Renji Hospitals are able to perform the following cutting-edge ART technology: IVM, blastocyst culture, blastocyst vitrification, embryos assisted hatching, embryos freezing, and so on. These could help to select the embryos with the greatest developmental potential and finally help the patients to get a healthy baby. More than 10,000 embryo transfer cycles are performed in Reproductive Medicine Center of Renji Hospital. Miracles are happening every day for the infertile women. Shanghai Key Laboratory for ART and Genetics was established in Reproductive Medicine Center of Renji Hospital with the research focus of ART, genetics, female infertility, and male infertility. The research results have not only promoted the SOP of clinical diagnosis and treatment, but also helped to realize the dreams of many more infertile patients of becoming the mother of a healthy baby. Renji Hospital has received the global certification from the Norwegian DNVGL Group at September of 2018 and become the first reproductive medicine center that, with global certification in China, providing safe and high-quality medical service for Chinese and international patients.
As the Quality Control Center for ART in Shanghai, we should make sure the success rate is stable in our center, as well as in other ART centers in Shanghai. We have the responsibility of helping other ART centers to achieve homogeneous development. The goal of quality control is to build a standardized ART and bring the safe and efficient ART treatment to patients. We hope this could benefit the patients eventually.
During COVID-19, patients are asked to follow a rigorous SOP of making appointments, registrations, and receiving medical treatment. The Reproductive Medicine Center of Renji Hospital has adopted intensified standardized precautions to guarantee the safety of patients and HCPs and to prevent nosocomial infection and the cluster epidemic as much as possible. Patients could get an appointment on digital platform of Renji Hospital to mitigate patients' aggregation at the same time. When patients entered the Reproductive Medicine Center of Renji Hospital, they are asked to scan the QR code to fill in an epidemiological history survey to trace their movement and possible epidemic exposure in the past 14 days. Various color of health code are automated generated according to patient's epidemic history. Green indicates low risk, yellow indicates mid-risk, and red indicates high risk. Health code will be checked at the outpatient hall. Each patient's body temperature is tested at the entrance of the outpatient hall. Patients with fever are directed to the fever clinic of the hospital. Suspected COVID-19 cases will be treated according to COVID-19 treatment procedures. Confirmed COVID-19 cases shall be transferred to the designated hospital in the jurisdiction for further treatment. Patients with normal body temperature and a green code receive contactless registration and payment services via automatic registration machines. Patients are asked to sit at intervals while waiting. When patients enter the consulting room, nurse will show the patients to sterilize the hands and check the case history. Afterwards, patients will enter the doctor's consulting room, will sterilize the hands again. Doctors will double-check patient's epidemic history. After reassuring the low risk of patient, doctors will offer counseling service or make a treatment plan for the patient.
At the beginning of realizing that I might have an infertility problem, I was really unhappy and confused. I tried to search in the internet, and I found that Renji Hospital is very famous and has a very high reputation in treating infertility. When everyone is worried about the outbreak, the medical staffs here still stick to their post and provide professional medical service for patients. I feel safe and comfortable to be treated here. Doctors here are very professional. They always give me the most appropriate treatment according to my situation. When I am nervous, the doctors and nurses give me support and encouragement. A couple of my friends also got their baby here. I believe in the near future I will have my own baby through this excellent team of Renji Hospital.
The novel coronavirus brings many changes to our daily work in this center, which includes of more rigorous triage procedure, more times of following up. The most important change is multiple ways of supports for couples to deal with this epidemic disease. All clients, as well as your embryo's safety, is our unremitting pursuit. So what you should do is give us your trust. Let's help you to bring a new life to your family.
Hello everyone online. 2020 is a special year since the WHO declared the outbreak a public health emergency of international concern on 30th January and epidemic on 11 March. COVID-19 has been reported in more than 188 countries and territories. I'm Huiqin, Director of Reproductive Center of Renji Hospital in Shanghai, and also Chief of Reproductive Medicine Branch of Shanghai Medical Association. At the special period, all offline academic conferences have been cancelled. I'm very happy to communicate with you through such an online platform, introduce our center, and how we respond to this crisis. Our center was founded in 2001. Has now developed into one of top 10 reproductive centers in mainland China. Our reproductive center is an independent campus which has 6 floors. The gross area is over than 7,000 square meters, including 12,000 square meters of clinic area, 1,000 square meters of teaching area, 1,000 square meters sperm bank, and 2,000 square meter Shanghai Key Laboratory area. This skeleton staff framework shows our clinical team. We have more than 100 staffs in total. For clinic department, we have 33 clinic, 17 embryologists, 50 technicians in genetic lab, 47 nurses, and more than 20 assistants. For basic researchment, we have 4 PI, 4 postdoc fellows, and more than 30 PhD and master students in the Shanghai Key Laboratory. There are 2,000 and 50,000 outpatients who visit our center per year. More than 11,000 hysteroscopy was performed. Over 8,000 IVF cycles and 7,000 FET cycles was done last year. Good quality control is what we think more of besides the increasing ART amount. It is proud to say that the clinical pregnancy rate in our center ranked the first place among 18 IVF centers in Shanghai and remained stable during past few years. We have summarized the data for the past 5 years as follows. The live birth rate in IVF is 46.87. For FET, the clinical practice rate is climbing year by year. Live birth rate has the same outstanding performance. It reached 50%. Shanghai Key Laboratory is not a place we are proud of. There are 57 live research projects in progress. 37 of them are national projects. And over 2,069 papers was published during past 5 years. We also conducted many clinical trials besides basic research. We are lucky the results were published in New England and Lancet. This is our IVF Center. In the next 15 minutes, I will share our experience, what we did during the COVID-19 outbreak. During COVID-19 pandemic, we provide persistent, effective, comfortable, safety, and convenient medical service in Shanghai of China. Our work will be displayed in the following 3 parts: background, actions, and achievements. On January 30th, WHO declared the COVID-19 outbreak as a public health emergency of international concern. As of April 26, some 180 countries and territories, which represent every corner of the globe, have reported at least 1 case of COVID-19. At present, there are altogether 1.6 million confirmed cases and over 130,000 related deaths. Shanghai has a population over 22 million, making it the greatest city in China. As a super reproductive center in China, we, the reproductive center of Renji Hospital, have served a diverse source of patients each year. The social responsibilities and duties have urged us to provide comfortable medical care and guard the health and safety of our patients and staff using our professional competence. As January 24th, Shanghai implemented the country's highest level of public health emergency response. Accordingly, we established a special response team immediately, held a conference by means of telephone, video, radio, and app. Our team assessed the risks and center preparedness. Fortunately, January 24th to 30th is the Spring Festival holiday. The minimal patient visit during the holiday, together with the sufficient medical supplies and reserves, give us preparation window. We produced the guidance documents on COVID-19 infection prevention and control at our center and updated them in time. Specifically to avoid non-essential touch, we rearranged the traffic flow in our building to set a one-way channel for patients and an independent channel for our staff during the Spring Festival. For staff, we formulated the staff protective equipment supply, planning, and training, so as to provide sufficient, effective, and economical personal protective equipment supply. Also, we encourage a staff self-evaluation and reporting system regarding body temperature, health status, and symptoms. Staff who get fever or who are symptomatic should be referred for medical advice and testing and should not re-attend the center. The staff training program was set up to reinforce the infection prevention and control principles, adhering to the recommendations by Renji Hospital, Shanghai Municipal Health Commission, National Health Commission of the People's Republic of China. For patients, we provided them with infection prevention and control recommendation. Recommendation for attending the expert clinical schedule arrangement via our WeChat official account. Moreover, we effectively communicated with patients before the initiation of a treatment cycle to improve quality and safety. To minimize in-person interactions and patients' number at our center, we optimized the patient visit process and time. To be specific, we established an outpatient appointment system, provided telehealth via hotline and APPS, and developed a prescription medicine mail service and online payment platform. More importantly, we reinforced the clinical evaluation and management to guarantee safety. All patients should have a pre-check, including body temperature, symptoms, and epidemiological survey before entering the building. Patients charged as a low risk can enter the building and receive our medical service. Patients charged potentially positive or positive should be referred to the fever clinic. To charge, the questionnaire was updated from paper to APP. And we also use Shanghai Health QR code to safeguard entry to our center since February 17th. The government supplied the service. The QR code comes in 3 risk status, marked with red, yellow, and green colors. Only the green ones can enter the building. We conducted our medical strategies according to the epidemic situation. The provided outpatient clinic and the perinatal diagnosis service persistently. Our service of embryo transfer and oversight retrieval were recovered since February and March, respectively. We also reinforced the SARS-CoV-2 associated tests before starting the ART treatment. Obviously, this strategy is in accordance with the subsequent Assam and ASHA guideline. Totally, we received over 34,000 outpatient visits during the COVID-19 epidemic period, with the first visit over 4,000. Compared with the same period last year, our outpatient visit recovered about nearly 80% in April. As shown in the figures, the number of embryo transfer was 194 in February, 465 in March, and 748 in April, which were 81.5%, 57.3%, and over 122%, respectively, compared with those at the corresponding period last year. In addition, the number of oversight retrieval was 109 in February, 350 in March, and 591 in April, which were 54.5%, 48.3%, and over 70%, respectively, relative to those at the corresponding periods last year. Apparently, the resumption of embryo transfer and oversight retrieval at our center is taking place quickly. This is our summary figure of staff charge. Staff self-evaluate and report daily before 8 a.m. Asymptomatic and charge-negative staff start to work normally. Staff with mild or non-specific symptoms or charged potentially positive should stay at home for medical observation. Staff with specific symptoms or charged positive should attend a fever clinic. This is our summary figure of treatment cycle. Patients are pre-checked 2 weeks prior to the initial of ovarian stimulation. Only patients charged at low risk can receive the standard procedure of ovarian stimulation. The procedure will be postponed for patients with mild or non-specific symptoms or charged potentially positive. These patients will repeat the charge 2 weeks later to decide. Patients with specific symptoms or charged positive should be referred to the fever clinic. Patients pre-checked negative will receive SARS-CoV-2 associated tests then. As well, the symptoms and the body temperature of patients will be monitored daily. Only the tests negative, normal temperature, and asymptomatic patients can receive the ovarian stimulation, oocyte retrieval, and embryo transfer standard procedure. Life is returning to a new normal in China as the COVID-19 pandemic relieving. While our center will continue to carry on these proper arrangements for safety and to provide infertility and productive genetic service at full capacity. Thank you.
Dear Professor and colleagues, it's a great honor to meet you. I'm Ning. I'm in charge of Embryo Laboratory, Reproductive Medicine Center of Renji Hospital. I would like to introduce the provision and control of Embryo Laboratory during the COVID-19 epidemic. The content is mainly divided into the following several aspects: health management of embryo laboratory staffing, disinfection and isolation systems, post-arrangement, basic protection, special protection, embryo culture and vitrification. The last one is the emergency plan for operation of suspected cases. Let's start with the health management of staffing. We give priority to the health and safety of medical personnel and patients. According to the requirements of staff management in our worker guide of hospital, staff need to report their temperature every day, use a special passage for employer, and perform personal protection as required. In case of fever or flu-like symptom, laboratory personnel should probably report to the leader and the epidemic prevention and control group of reproductive medicine department. The staffing who is diagnosed as suspected patients should immediately receive home quarantine or go to a doctor according to patient's condition. Dr. Sun has the details introduction here. We should strictly observe the disinfection and isolation systems, the protection measure for laboratory personnel and environment, and waste disposal shall be taken. Our lab environment clean air depends on laminar flow purification system. Our main culture rooms are 1,000-class clean rooms. The semen treatment embryo freezing rooms are 10,000 grade clean rooms. Air handling unit and fresh unit will be checked regularly to keep them clear. The air outlet shall be cleaned once a week. Our lab is not equipped with ultraviolet light. Ultraviolet disinfection lamp will cause damage to laboratory equipment and shorten their service life. We should strictly observe the disinfection and isolation systems. the protection measure for laboratory personnel and environment and waste disposal shall be taken. Our labor environment clean air depends on laminar flow purification systems. Our main culture rooms are 1,000-class clean rooms. The semi-treatment embryo freezing rooms are 10,000 grade clean rooms. Air handling unit and fresh air unit will be checked regularly to keep them clear. The air outlet shall be cleaned once a week. Our labor is not equipped with ultraviolet lighter. Ultraviolet disinfection lamp will cause damage to laboratory equipment and shorten their service life. The ground was disinfected with available chlorine solution. The workshop was disinfected with 75% alcohol and all safe station disinfectant for IVF labor. About hand hygiene, we use disinfectant containing ethanol and hydrogen peroxide while entering and leaving the laboratory. We need to use the all safe hand disinfectant during laboratory work. In terms of the post arrangement, our staffing is split into two independent groups. These two groups do not meet each other in case of suspected cases. If the protection is imperfect, all members of the group shall be excellent. Another group will not be affected. The egg collection and the semen treatment posts are relatively independent. While entering the labor, the personnel must change the special slippers, wear the disinfection and isolation clothes, wear the disposable hat, disposable surgical mask, and carefully implement the hand hygiene. We should carefully use all sharp instruments to provide stability. In case of sharp instrument injury, it shall be handled in accordance with the treatment process of sharp instrument injury. Staff responsible for egg collection and semen treatment shall wear protective suit, gloves, and protective goggles during sample collection and operation period. If you contact with patient's blood or body fluids, you need to change gloves in time. While contact with sample of a suspected cases, personal protective measures should be taken according to the novel coronavirus fields of Renji Hospital. After egg collection and semen treatment, all discarded measures shall be removed from the laboratory immediately and put into a special pollutant bag. Disinfect hands and replace sterile gloves between two operations. If any liquid drips out during the work, immediately wipe it with gauze dipped in special disinfectant. Two posts are relatively independent and try not to participate in other positions. During the epidemic period, all incubators for embryo culture of patients are dedicated and independent. High security straws were used to embryo vitrification. We adopt the closed freezing cryotop. Liquid nitrogen tanks for embryo storage are used separately. We formulate emergency plan for operation of suspected cases. If the man is a suspected patient, sperm extraction will be cancelled on the day of collection, and the woman's egg will be frozen. The woman is a suspected patient. Staff of embryo laboratory need to prepare instruments cultural solution and dish, and cooperation with the clinic to complete the egg collection in the negative pressure operating room, and then use the special transfer incubator to transport the eggs back to the laboratory as soon as possible and freezing the eggs. Fortunately, there was no egg retrieval operation for suspected or confirmed patients during the operation of our center. These are my reference guide documents. Thank you for listening.
Hello everyone, nice to meet you on the web. I am the Deputy Nursing Director of Renji Hospital, as well as the Nursing Manager of Renji Reproductive Medicine Center. My name is Huiqin. In the next 15 minutes, I will share my experience during COVID-19 epidemics, both in the Reproductive Center and the Wuhan Leishenshan Hospital. First of all, may I introduce myself to you? I have just told you my job position. Before I came to the Reproductive Center, I have been the head nurse of rheumatology department for 15 years. We treat severe patients. One kind of rheumatology disease is dermatomyositis, which has the same symptoms with COVID-19. Because of this experience, I have the honor to participate in fighting with this virus in Wuhan. We save patients in the ICU of Leishenshan Hospital. I was the head nurse of ICU in that time. So may I say something about the nursing in such critical care of COVID-19 patients? Picture on the left shows us the overview of Leishenshan Hospital. Though it is a makeshift hospital, it was scientifically designed to treat pneumonia patients infected with COVID-19. This hospital was put into use during February 6th to April 15th with capacity of 1,500 beds. Staff in this hospital came from different areas of China. We were formed in a new organization. Team from Renji Hospital was composed of 62 doctors, 96 nurses, and 6 administrators. We should cooperate with other teams so that we got enough staff to run on the ICU. When we arrived at this hospital, the ICU is empty. It ought to be equipped with life support machines and furniture before it put into use. We only used 4 days to complete all the preparation. We started to admit patients at a short time. One of the important things we do before admission is PPE training. In isolated room, we use the highest level of personal protective equipment. Everybody should pass the PPE examination. Otherwise, they cannot work in the isolated room. It was the initial stage of the epidemics in China. Staff did not have enough awareness of this infection disease, including of the basic knowledge, skills, competency, even the protective skills. We formulated an online platform to quickly educate our staff. There were 25 courses on the web, which is short and well-designed completely according to the critical care of COVID-19. In addition, these courses are short time and highly efficient. Each episode is less than 15 minutes. Some of them were directed in the real scene, just like the PPE training. The next thing I want to mention is supports for nurses as well as all the staff. In the epidemics, medical staff had to face to the death to deal with the sudden change of patients' condition. Though they are brave, they still need support to help them release the psychological pressure. Firstly, we have an infection control and prevention team. One part of their responsibilities is to check the PPE for all staff and monitor the procedure of taking off PPE. These measurements gave our staff psychological support because of the confirmation of being well protected. Secondly, we also have psychologists in the team who help us to do the follow-up psychometrics. He detected problems and do consultants for all the staff. Thirdly, peer support is quite useful in this team. Pictures drawn by the staff on the protective suits, words of else, expresses their wish, interests, and a blessing for the patients and Wuhan. Every day become full of hope, happiness, fond memories, and even expectations. Even in the epidemics, we still want to go into patients' hearts to help the medical staff understand their patients in such a special period. We open an online platform for patients to write down their experience during the epidemics. It is a useful way to know what they need when they live in the isolated room. Voice from our patients not only concerned about appreciation for the staff, but also the stories about their families in the epidemics. These are my experience in Wuhan fighting with the COVID-19. And next, let's go back to Shanghai, to our reproductive center. Actually, I started my anti-COVID-19 work here from the Chinese New Year. This is almost 1 month before I went to Wuhan. That time is the real initial stage of these epidemics in Shanghai. For the whole staff in Renji Reproductive Center, we contribute to identify the suspect clients before their clinic, and so we can protect other clients, as well as ourselves. We designed a rigorous triage procedure, however, not complex for the couples. This is the first step that is processed before the clinical day. Couples need to make appointments on the web and complete the epidemical questionnaire. Meanwhile, check the body temperature and confirm it is normal. According to the local policy, we should apply a valid Shanghai QR code. Clinical day. Before the couple come into the clinical dorm, they should show triage nurse their ID cards, the results of epidemical questionnaire, and a QR code. At the same time, all clients must wear masks throughout the clinic. This is a pathway of triage. It shows that clients without fever and epidemic history can come into the clinic after triage. Otherwise, they should be judged by more conditions. We pay high attention to patients who has referred to fever clinic and record the information of them. We follow up whether the patients go to the fever clinic and the results of diagnosis. That should be done only 1 hour after the transfer. For clients come for reproductive operation, we also process the procedure of clinical day. This is a procedure of IVF operation. And this is the procedure for hysterectomy. That is for embryo transfer. In each procedure, abnormal clients are stopped before they go into the clinic, so we can protect others. To the great extent, the basement of protection is rigorous triage. There is an emergency plan we process for egg retrieval women. If we meet a suspected patient, according to the clinical assessment, egg retrieval operation is inevitable. We will start the transfer process. Patient will be transferred to another campus. There is an isolated operation room prepared for the infected patient. To prevent the infection, there is other management interventions. They are equally important, such as the environment management. We encourage clients to do pre-consultation appointments to reduce the waiting time, fully inform and remind the couples well personal precaution during the clinical. The door of clinic is one-way design. As to the consulting room, we emphasize on the disinfection of equipment, surface of objects, and environments. While for the treatment room, we increase the level of disinfection, including the disinfection concentration. Restrict of hand hygiene is an effective way to prevent infection. There are some points for attention about the equipment. Use non-contact equipment as you can. Enhance disinfections of any equipment. The selection of disinfections should be based on the virus. Personal precaution of staff in reproductive center is recommended to different level according to policies from local health commission. For the triage nurse, they use level 1, but plus the gown, shoe covers, and a face shield. For the clinical staff, they only use level 1 prevention, which includes the masks and gloves. Staff was given some notice before their work. That is, take staff access to clinic. Attach great importance to the prevention of COVID-19. Keep a social distance when they're doing the consult. Staff should also do self-monitoring every day. They should report body temperature and whether got physical abnormalities on the web. We were advised not to leave Shanghai at that time. If we have to leave, we should report leaving in time. As to the support of clients, we focus on fully informed than ever. The content of information is about know the epidemics, how to continue treatment during COVID-19. We publish these education materials on the WeChat subscription that couples can read them anywhere. We encourage couples to adhere to the way of seeking a child. The epidemic will pass. Everything will go back as usual. Our nurses provide online consultation too. This is a better way to satisfy couples needing on time, as well as some emergency need. That's all I want to share with you. Hope it is useful. Thank you for your attention.
Great. I would like to thank the various speakers for their splendid efforts in putting together the brilliant presentations. And on behalf of all of us present in this seminar, I would love the sincere appreciation in the usual way. And while you're preparing your questions and sending in, I'd just like to say a few words. I won't repeat what they say, very comprehensive, but I just want to sum up by saying that the reproductive team, under the leadership of Professor Sun, has shared with us their very good experiences in the clinical, laboratory, and nursing care of their patients during COVID-19. How they successfully adapted their practice and modified the procedure in a very constructive way. I myself found many useful tips for myself, and I hope you'll find that too. And certainly it provides some good insights into how we can each modify our practice to fit local needs. Let me explain to you about the Q&A session, which is going to follow. Now, it will last about 30 minutes. You're most welcome to send in your questions. You can either address to a special speaker, or we can Professor Sun could nominate an expanded panel team member to answer those questions. So we can't have a voice interaction, but you're welcome to type in your questions, and the coordinator will send the questions to me. And I'll pick up what I think would be the most relevant questions and interesting one I hope we can cover about 5 or 6 questions or more if we have time. but the answer to each question perhaps should be no more than 4 or 5 minutes, so that we can cover a wider range of questions. And we hope we'll be able to finish by 4:30 China time. So I hope the arrangement is clear for everybody. Now I would try and look at the questions now on my mobile phone and see what questions have been sent in. Okay, first question that come up on my mobile phone is a question to Ning Yao. How do you maintain negative pressure in the IVF lab? And what is the direction of airflow? So Dr. Yao.
Sorry, Professor, can you repeat your question? How to maintain your...
How do you maintain negative pressure in the IVF laboratory? Negative pressure.
Actually, how about I answer this question,
Okay.
Professor? So this surgery room is not for routine use. It's just prepared in our another campus, in East Campus, where we have a lot of surgery room there. So if we have COVID-19 positive patients, we will send this patient, if she has OHS risk, we will send him to her to a negative pressure surgery room. So this room is not for routine use, just to prepare. And we didn't use that during this COVID-19 and pandemic. Yeah.
Okay. So I think that's fine. That's answer the question. The second question, which I think is also very practical. Let me read it. It's about informed consent. During the COVID-19, do you arrange specific written informed consent for your patient to sign so that they are aware of the possible risks should they conceive during the COVID-19 period? Do you arrange a special consent? And if so, could you highlight what are the items in there?
Yes, yes. You choose one to answer the question, or
either one of you. I mean, Professor Sun could nominate someone.
Okay.
Yes, begin the ART treatment, we talk to each couples during this special time for the high-risk patient. For example, the diabetes, the hypertension, and using the immunosuppression therapy, lung, liver, or renal disease should not start ART treatment until it is deemed safe to do so by the relevant healthcare professionals. All patients should be offered, we will give them a choice to proceed with or postpone their treatment. In both cases, if the patient makes a decision, we should be clearly documented, and we clearly explain the risk relevant to the COVID-19 disease, acknowledge the increased risk in case of infection during the pregnancy. If the patient, if the couples understand what they have done in this special time, then we will also tell them how to reduce the risk of infection in general. And patients must sign the informed consent form before they start the COH treatment.
Good.
This is what we do before the ART treatment.
Well, I'm pleased to know that. I'm pleased to know that you do have a specific consent. I have to say, in Hong Kong, where I practice, both hospitals that I work in, one a teaching hospital in the university and the other in the private sector, we both have a written consent. It doesn't need to be very elaborate, 1 page. But I'm also pleased to know that you also give them an option of delaying the treatment, like embryo transfer. Because once you explain to them, some of them do say, hey, by the way, I don't want to do it now. I want to come back 2 months later. I guess especially during February time, when it is in the peak. So people might worry, don't know what would happen in the ensuing month. But I can see that in April, you pick up Dr. Sun's lecture, so that in April, your treatment is more or less gone back to normal. I presume people are more relaxed. And so I'm delighted to know that you are also offering patient-informed consent, which I think is very important. Yeah. Mm-hmm. Now, there is another question about similar question, which is about pregnancy, because you highlight that you give them some advice, what to do should they conceive. Now, do you give them information about what should they do? What are the risks during pregnancy? And what should they do about pregnancy, should they are so lucky to conceive? Do you give them information, or do you wait until they ask you about this?
Yes. I mean that because the pregnancy is a very special time for women. So if she got pregnant, we will, and as they know, this is the risk of COVID-19. It's a virus. The virus will maybe, have an impact on the fetus, but we have no data to show that. So we should tell every pregnancy woman to, to do the monitor and to do their prenatal diagnosis like this. Mm-hmm. And then we also,
Yeah, I've been asked many times myself, and I often, like you, I would say, we really don't know the answer. We think there's a small risk, but we can't quantify the risk because no one knows. Maybe now we have a little bit more data as we go along. But in fact, in March, I think we have very little data on that. But presumably we have a bit more. So I guess most of us would say there is a bit of uncertainty going on, and we don't know.
Yeah.
Okay, that's great. Now, there is another question, very interesting question. I hope. It says there, and the patient is undergoing ovarian stimulation after so many days, and just before you plan to do a trigger for oocyte retrieval, and suddenly you find that she's now test positive. So COVID-19, what do you do if suddenly there is a patient in the middle of the treatment say that I'm now test positive? What are the things that you would do?
Yes, we will cancel the cycles. Of course, to avoid the risks of OHSS, we will not trigger. Some study has shown that the COVID-19 is highly binding to ACE2, which was highly expressed in ovaries and testicles. So we will suggest that the positive couples to do the following up and treatments. We will give them the advice after 3 to 6 months after they're cured. During the ART cycles, we also give the couples some virus tests associated with respiratory system. If the tests are positive, we will postpone the treatment. But if the patient tests positive before trigger, we will reevaluate the condition of the patients to make a decision. Especially if the patient is at a very high risk of OHSS, we will do the oocyte retrieve in the negative pressure operation room, and the measures are taken to reduce the risks for our staffs to avoid the transmission of the virus.
Okay. That's fine. I think you got most of the point right, but I have a question about contact tracing. Does it ring an alarm bell? So if the patient is going through your clinic and now in the middle she had test positive. Who did she make contact with? Doctors, nurses, other patients in the waiting room? Are you worried that there might be a chain of infection going around? Do you stop your staff working, the one who have close contact with the patient? Do you understand what I'm trying to say? So an important issue is, who do you trace? Do you have a system to trace the contacts and stop them from working for the time being?
So may I answer this question? As the head nurse of this clinic, so I have mentioned in my PowerPoint, we stop the patients, the suspected patients out of the clinic. So if the patient got fever or they have the epidemiological symptoms history, they cannot go into the clinic. So we can keep the safe of the patients in this clinic or our staffs. Then if it's unfortunately the patient come into this hospital or in this clinic, we have record every day all the patients coming have been see the doctor in this hospital. So we can check the list on the web. We know the record of the patient's clinic. So we can find out these patients and contact with them. According to the local policy, we will give information, report the information to our government. They will post it on the Shanghai announce. Shanghai announce. So we will trace all the people they have been to this hospital at the same time. Is that okay?
Okay. So, yeah, I know that every locality has the different way of contact tracing and the rules, but it sounds as though you have your own system whereby you protect other patients and staff and making sure that there is not a chain reaction infecting so many staff and so many other laboratories and so on. So, yeah, I guess every locality is a little different. We do have our own system in Hong Kong, which is a little different to yours, but good to know that you got a system. Good to know. Now, there is another question, which is on the more clinical aspect, a question coming in. I guess this question is addressed to Professor Sun. Now, it asks about during the COVID-19, because there is this recommendation about social distancing. So we try to avoid the patient getting too close contact and getting contact with doctors and nurses. Do you ever change your protocol to reduce their clinic visits? Do you change everything so that they come back to your clinic less often? Because the less they come, the less contact there is, and perhaps there's the less risk of infection or potential infection. So is there any clue, any tips that you have made about reducing patient contact and patient visits? Changing your protocol? Is it a difficult question?
Yeah. I invite Professor Hong, to answer your questions.
Okay. Yeah. Professor Hong. Okay.
She's charge our clinic, so okay. I think key person for this question. Yeah.
Okay, I will say something about our duty in this outbreak. At first, when we after a spring festival, we begin our clinic. Then we chose the antagonist protocol. Be the first choice for our ovary stimulation, because the day of the stimulation is very short. So the patient will stay at our hospital in a more few days. And for the potential harm to the ovary and testicles and possibility of infection of virus, we can sell the fresh embryo transfers. We do freeze all. So when the patient have finished their ovary retrievals, they will return their home and they don't need to come back to our hospital. And I think it will decrease the patient's residence in our hospital. And also, we recommended our patient inject by themselves at home. At the present time, at the last years, when we don't meet the COVID-19, the patient always want to inject in our hospital because our patients, they don't like to inject by themselves. They no like to do this because they are very afraid of inject by themselves. But in these special times, we ask them to do by themselves, so they will finish their test and will go home. And this is in order to reduce the patient's residence in the hospital during our treatment. This is what we have done in our clinic. Maybe do you have something?
Okay. Yeah, sorry. Any backup? Any addition?
I want to, for the nurses aspect. So during the COVID-19, we educated patients more about how to do the injections themselves. So before the epidemics, they don't like do the injections themselves in their home. But because of this, it makes a big change for the patients. They would like to do the injections themselves in the home. So we give them the small videos about how to do the injection. That is very important. And ask our nurse to ensure they can do watch the first time they do the injection in this hospital. Then we give them back home. Yeah.
Okay, that's a good point too. But let me ask you a question. Suppose if the patient say, no, I don't want to do the injection myself. I'm so frightened of needles. I can't do the injection myself, which I'm sure you know there are a few patients who can't do the injection. So what do you do then?
So one way my patients tells me is that they got an app about the nurse. They can go to their home to do the injection for them. That is the DD nurse. Really, that's
what we do in Hong Kong. We ask the husband to do the injection.
That's why.
The husband like it because both in Hong Kong and in England we have practice. When the husband do the injection, when they come back, they're always very happy. They say, well, when I'm doing the injections every day for my wife, she always make me a cup of tea, make me a breakfast, look after me very well. Because if she doesn't, then she's frightened of me, my needles. So encourage the husband to do the injection, which is very good. All right.
Yeah.
Now, one more follow-up question about modifying our practice. Now, we know you're very good in using WeChat and telemedicine. Do you try to use more about talking to patients through WeChat instead of asking them to come back? In other words, do you communicate more with internet and WeChat and other tele technologies? Is it helpful? Do you think it works?
Oh, okay, I will answer this question. I think it's very helpful in this special time because to minimize the in-person interaction and service patients who are geography distant, we use telephone, we use WeChat official account and apps to perform new patient consultation and also follow-up consultation for existing patient and patient education in preparation for planned treatment. Obviously, the telemedicine also has its limitation for patients who prefer a more personal or face-to-face relationship with doctor. So certain types of illness and emergency problems such as ectopic pregnancy, abortion, or abdominal pain require a face-to-face physician assessment and test, and it cannot be diagnosed and treated through the telemedicine. So some patients from other provinces, not in Shanghai, and especially rural regions, they cannot use telemedicine hardware. For patients abroad, we also have some patients in USA, in Canada. The time difference can cause inconvenience when communication with doctors. So I think this is the limitation for telemedicine, but very likely to use WeChat and use telemedicine to serve our patient during special time. Yeah.
Okay. All right. That's fine. So now I want to move on to another question, which is a follow-up question. This is from a question from Taiwan, and it's to an embryology colleague. And it says here that a patient confirmed infected COVID-19 just after egg retrieval. In other words, you have retrieved the egg, and suddenly the day after or so, she said that I'm now test positive. So how will the embryology team handle the rest of the treatment? For example, the eggs, oocytes. Do you treat it like a HIV infected material? Or what do you do? How do you do it in the middle of something like that, having retrieved the egg, is test positive? So embryology.
是两组的，对吧？如果发现阳性的，
这个需要是另外一组上来。In our embryology, our work staff was divided into two groups, and they are very don't meet together, don't meet. And today, this team work, the other rest. So during this during the period, if we found the positive patients, so the other team will come for work. Yeah. And the embryos were freezed in special nitrogen tanker.
Okay, but at the time you didn't know about this. It's only afterwards you realized that it is test positive. So what happened to the whole tank that the specimen are shared with others? Do you know what I mean? Because at the time you handle it, the patient wasn't positive.
你的胚胎是封闭式的。您刚才讲过，你说一遍，把那句话再说一遍。你是封闭式的，不是开放式的。
So the embryos were freezed in the closed container, so cannot contact with other embryos or nitrogen. Yeah.
Okay. So I guess afterwards when you store them, you say that you store them in a separate tank to reduce risk of infection, isn't it? Even though it's a closed system. All right.
Closed system. Yes.
Closed.
All right. So there is another question from Singapore. It says that they have gone through a system where they have not treated patients for a long time, and they're now about to start the treatment. What precautions, what steps would you recommend them to do before they start offering patient stimulation, oocyte retrieval, and embryo transfer? Is there anything that you would recommend or when to add specifically? Sharing your experience of when do you start the treatment again?
I think before they want to start their treatment, 14 days before, they should, send their message or their information to the hospital to do the triage. I think this is very important. 14 days before, you should, connect with your doctor and to report your, healthy condition.
Good point. This is a very good point. Triaging, and also notifying well beforehand. And I guess the consent, informed consent, is important too. All right.
Yes.
So, any other points you would like to recommend before starting? I guess giving them an option of delaying it if they want to wait until there's better control. But it looks as though in China, in Shanghai, you have so many patients coming back now for the treatment in April. Your activity is really more or less back to normal. So, which is amazing. They're all very keen to start.
Yeah.
I guess on the patient side, but another question I want to ask is, have you changed your protocol, stimulation protocol? Do you use, for example, certain type of protocol more often nowadays in COVID-19, or do you still use a traditional protocol? For example,
yes.
I know there's a question here. Do you use antagonist protocol more in COVID-19?
Yes, Dr. Hong already mentioned that we use more antagonist protocol. Antagonist protocol will be the first choice in the outbreak because it takes, slow timing,
Okay, and do you then use a fixed protocol to avoid patient coming back more often? Because I guess in a flexible protocol, you need to monitor them. You need to check the follicle. You need to check the estrogen. Whereas a fixed protocol, I guess you can see them less often. Is that right? Is it what you normally do in a situation like that? A fixed protocol?
Yes, I think in February and March we use more fixed protocol for our patient. It's easier to handle. But nowadays, in this month, we half fixed and also flexible. Yeah.
Okay. Do you think the long-acting FSH helps, or do you think it doesn't really help with cutting patient visit? Do you change?
No, we don't. No, we don't think so.
So you don't think so? Nor do I. I think it doesn't really add much as far as the cutting down the patient clinic is concerned. Because if you use an antagonist protocol, they don't need to come back for you for 7 or 8 days, which is quite handy. You can then cut down the patient visits, and therefore the social distance. So that's great. That's good. Okay, now let us see whether there's any other questions that are interesting.
Professor, can I have a question for you? Do you have time?
I thought you are. Okay, all right.
This question is, you know that COVID-19 infects the target cell by binding to ACE2.
Okay.
Yeah. And the ACE2 is abundantly expressed in the ovary. So back to your question, you mentioned that if we find a patient positive, the COVID-19 positive during the treatment, we postpone the treatment. Do you think it's necessary we recheck the image or something else after the virus antigen transfer to negative? Is that necessary? Do you think so? Because binding to ACE2 maybe to influence the ovary function. So after, what do you think?
First of all, this is a very good question. A very scientific question, all right? I honestly, personally, I don't know the answer, but it will be room for a very good paper, very nice paper, scientific paper, in a high quality journal. If you have enough cases and you look at them, I think you should examine the ovarian function in those who've been infected. But at the moment, I guess there is a concern that it could do, but it will warrant some observation. Very careful observation, follow up on what their ovaries are doing. It's a very good. I don't know who the audience are. For those who audience here who are listening, if they got some cases, it could be a basis of a very nice observational study, especially got statistical cases. But for me, myself, I know that nobody knows much about the answer as yet for the time being.
Maybe the doctors in Wuhan reproductive center, they will have data, right?
They will. I guess if they would, you should ask Dr. Liu, the immunology. Dr. Liu, who is involved in it, and maybe she would have looked at the immunological profile of this patient and how they interact with the ovarian function. So maybe next time around, I don't know whether she's in the audience, but if Dr. Liu, Professor Liu, you are in the audience, maybe we can chat afterwards.
Yeah.
All right. Okay. So another question is about prioritizing patients. So when you restart the program, when so many patients want to come to see you, do you have any prioritizing rules? Who do you want to treat first, and who do you just work by a first come first served basis?
低落就是病人分娩低落问题，病人的选择和分娩是原来遇到的一个问题。这个第3个 ，we value every couple's link。这2个吧，1和3和3。
Thank you for your question, Professor. May I answer this question? First of all, I want to say that we value every couple's choice. We inform that all couples who prefer to proceed with ART treatment on the risks related to COVID-19 disease and the increased risks in case of infection during pregnancy comprehensively and clearly. The couples who are clearly understand and acknowledge the risks and still choose to proceed the ART treatment will respect their choice and will treat them safely and effectively. And actually, based on our experience during the COVID-19, women with poor ovarian response inclined to proceed the ART treatment. Besides, couples who are busy working before COVID-19 finally have a break, and they also inclined to push the ART treatment. So we value everybody's choice. If they want to do the ART treatment, and if they understand the risk, we'll do it. But we'll make them acknowledge the incident conform and make them know the risks. Thank you.
Okay. All right. I guess you have to work out your own prioritizing. Each clinic, you might have your set of protocol. I just come up. There's another question on the embryology side of things. On the patient suddenly get infected. Say just in case if there's an occurrence, would it be a good idea to store all the oocytes and embryos collected during the COVID-19 period into separate nitrogen tank and not let them mix with your coexisting patient, just in case if any one of them get infected, then you can limit the damage. So the question is, should the embryo gametes collected during that period be using a special separate nitrogen tank? Yes or no, I guess is.
Thank you for your question, Professor Lee. In fact, in our embryology lab, all embryos will be stored in a separate tank. For embryo prior observation, all the embryo will adopt the closed freezing biota, so it is safe during the epidemic.
Okay, so you do use a separate tank, huh? You use it just in case there is any inadvertent discovery of a positive patient. Then I guess you do the cut in there. Okay. Now, I think there is just one more question. I think we are running out of time now. We got a few more minutes. There's a question about what patients ask commonly. What are the common questions that people ask you during the COVID-19 period? So when people come to you, what are the 3 or 4 common questions they ask you?
Thank you for your question, Professor Lee. Many of the questions that the patients are most concerned about are like, when can I start treatment? Is it safe for me to start treatment? And what if I am tested positive during the ovarian stimulation cycle? So many of the questions answered, I think we have answered them during earlier. And another question that the patients are very concerned about is that whether it is safe for them to do IVF during the COVID-19 pandemic, and will the COVID-19 virus affect their ovaries, oocytes, or embryos? So during the outbreak, we also sent out
many popular signs for patients and also for the public during the outbreak, letting them know that what we know is that studies do show that the COVID-19 infects the target cell by binding to ACE2, and there is ACE2 expressed in the female ovaries as well as testes. Therefore, although it is lack of evidence now, but in theory, the ovaries and testes and oocytes all might be potential targets of the COVID-19. So it is possible, there is potential possibility that COVID-19 may impair male and female infertility. So for patients who are infected with COVID-19 to be cautious, we suggested a following up and evaluation of fertility after recovery from COVID-19 infection and delaying ART treatment and becoming pregnant, if possible, especially for younger women. And also for the public, for men and women from reproductive age, we recommend fertility evaluation after COVID-19 infection. For patients who are concerned about the safety of their embryo cryopreserved in our center, we'll let them know that their embryos is perfectly safe with us. Thank you.
Okay. All right. Now, there's coming up one last question in the next 2 minutes, which I need to close. And that question is, someone is planning to reopen the service after COVID-19. So he mentioned, would you test COVID-19 PCR antigen or antibody, or X-ray, or chest CT scan, or only by symptomatology? So what is the practical test you would recommend clinic reopening that you think they must do?
Yeah, may I ask this question? So according to the policy of Shanghai and our hospital, so the patients only that got fever or they have the epidemiological history, they wanted to, they should be tested the PCR. So the other patients, if they will, they can do. So we open many PCR testing in several hospitals in Shanghai. So for our hospital, we can do it on the west, in the east campus. So if patient wants or they got fever or got the epidemiological history, we will refer the patients to this campus to do the PCR testing. And otherwise, they don't need to do it. So for the chest rate, CT scan, this is not necessary now, but it must be done in the initial stage of the epidemics.
Okay, we've got 2 more minutes. I must conclude the meeting now. First of all, I'd like to say it is a very successful one. I myself learned a lot, and I hope that you do too. I want to thank all the speakers again for their hard work and for their splendid presentations, and also to Professor Sun for her leadership. I want to thank Ferring for the sponsorship, without which it's not possible to have this webinar education activity. And I also want to thank all of you for your participation and for the questions and for the discussion. And I'd like to say bye for now. Thank you, everybody.
Bye. Bye.